Good morning, everybody. Thank you so much for tuning in to the webinar this morning. This is Kate Quigley from the United Way of Connecticut 211, and we are thrilled to be offering this webinar, the last webinar of our fall series. So we're going to be discussing today the Norwich Coordinated Addiction Recovery System, or CARS, C-A-R-S. And I am happy to introduce our presenter this morning is Kim Lothar-Jackson. She's our Opioid Enhanced Information and Referral System Program Manager, and she is going to talk to you about the CARS project. We will have some time at the end for questions if anybody has them. So just a little bit of housekeeping before we begin. All of you that are participants today are currently muted, and at the end, when we do the question and answer section, you'll just chat the questions into the chat box in the webinar software. We'll save a couple minutes at the end for that. I did just want to also mention that any of these webinars that we have offered in both the summer and fall series, they have all been recorded and they are on our public website. And just so very quickly, and then I'll pass it to Kim. To access those, you would go to our professionals tab on our website, so 211ct.org, and then the professionals tab. And then under outreach and training on the right column, the archived webinars are right here, so those are all of the recordings. So if you wanted to tune into one and missed one during the last couple series, you can watch them at your leisure. If you want to request a webinar, that's also something you can do from this page, and we're happy to try to accommodate as many of those as possible. And then when we do another series, upcoming webinars, they'll be listed here. All right. So without further ado, I'm going to turn it over to Kim. And thank you again for tuning in, everyone.
Thank you, Kate, for the introduction and the reminder. This morning, as Kate mentioned, I'm going to highlight a pilot program that 211 has engaged in with our partners, Reliance Health Incorporated. We are providing specialized information, referral, and assistance to individuals seeking addiction recovery resources for themselves or a potential recovery as a third party. A little background on why we're doing this. As you are possibly aware, Connecticut's opioid crisis has been in the forefront of the news, unfortunately in the forefront of some of our own personal lives. And to give you some statistics from 211, in the program year 2016, our 211 contact specialists handled 7,795 service requests related to addiction and substance use. That's a 21% increase from 2015. Over a 5-year period, dating back to 2012, there was a 28% increase in the number of people receiving DEMIS-funded or operated opioid treatment, and that is just here in Connecticut. And tragically, across the same 5-year period, death by accidental intoxication involving opioids increased by 177%. So, also, our statistics here from 211 led us to see that 42% of the requests that we received for information and referral to assist people in their recovery came from females. 58% of the requests came from men. And those of you who have been to our website, the number of views in 2017 for substance use was nearly 2,000. So obviously people are looking for assistance, and 211 is here to assist people in finding the right information at the right time. We were awarded a CHIFA grant, the Connecticut Health and Educational Facilities Authority, in early 2017, approached us with an idea to address the opioid crisis. We connected with key state agencies and partner agencies to learn more and to put together a proposal, which led to us being awarded funds to create an enhanced information and referral service to run from April 17th till the end of this month, November 2018. With that grant, we provided and continue to provide enhanced training for 211 contact and resource specialists. One of the key components of that training is once we hear someone on the other end of the line seeking support for their recovery, is to greet them with, how can I help you with your recovery today? We were also able to fund the pilot to enhance our assistance and services using a care coordination model, which we're going to talk about in a little bit. We are also able to pilot a recovery coach partnership and create substance use and addiction screening tools and resources that you can use through our web portal at healthylivesct.org. There is already a webinar on that. You can find it, as Kate showed you already, on the professionals page. So the enhancements for training our contact specialists, we needed to beef up some of our professional development. So we worked with our state agency partners at DMIS, DPH, DCF. We also were able to benefit from education provided through our partner agencies, Reliance Health, Inc., which is located in Norwich, Beacon Health, which helps us to better understand Access Line, and CCAR, through which I received and another staff person received a recovery coach certification in an amazing 5 days of training. We were able to utilize that for a new training module on opioids and substance use disorders, and added to our contact specialist training overall, including our new hires. From those trainings, the biggest lessons that were learned after polling the staff was, one, the language of recovery, as well as, even though many of our callers are looking for inpatient treatment, outpatient medical assisted treatment is an effective recovery option, and DMIS, as well as other medical providers, recommend this option and have found it to be most successful for most people. This that you're looking at now highlights that language does matter. The most respectful way of referring to people is as people. So rather than calling someone an addict, you would refer to someone seeking recovery from an addiction. And an individual who is not yet in recovery is not an untreated addict or an alcoholic. This slide gives you some alternative terminology, which reminds us all that this is a disease and that the people suffering from it are people. They are somebody's mom, somebody's sister, somebody's brother, somebody's father. So keep that in mind. So the goals of the Norwich Coordinated Addiction Recovery System, or to abbreviate it, we call it Norwich CARS, are to plant a seed of hope that recovery is possible. They are to empower each person to lead their recovery plan, shorten time to connect person seeking recovery to treatment, lengthen the amount of time a person sustains their recovery, increase number of family members and loved ones connected with recovery support services, increase the number of referrals for basic needs for a person seeking recovery by providing access to wraparound services, and to increase care coordination through the use of a shared database system and structured collaboration among providers. The reason that we were looking towards a coordinated approach is that social service providers are increasingly turning to this approach because it includes a clear starting point, knowledgeable staff, mechanism for determining the most appropriate service, providers working together, consistent response and data collection and reporting, and the ability to track outcomes. 211 is currently involved in 2 state agency-led coordinated service delivery approaches that some of you may be aware of: the Emergency Mobile Crisis Service, or EMPS, and the Coordinated Access Network, or CAN for short, for shelter and housing. Both of those models, with the coordinated approach, have been able to serve the people of Connecticut better, as well as to help us standardize some of the entry points in order to learn from the best and make those best practices statewide. Norwich CARS is unique, and this slide helps you to see some of the ways in which it is unique. As you know, if you have tried to assist someone with a substance use disorder, finding the right help can be very overwhelming. So Norwich CARS has an easy intake process and access to recovery help via 211. The recovery contact specialists are dedicated to the project, as well as a full-time recovery coach is dedicated to our project and working out of the Norwich area through Reliance Health Incorporated. There is follow-up care and coordination, a coordinated network of community providers, a shared client database, and data collection for quality assurance, accountability, and data-driven decision-making, which is not only important as we move forward past the pilot, but extremely important when you are conducting a pilot in order to see what's working and what needs to be fixed. So why Norwich? If you take a look at these numbers, which are from 2017, 31 of 34 deaths involved in opioid in the Norwich town, or the town of Norwich alone. And you can see that for their population, that is 8.46 residents died. Any death is too many, but for a population of less than 41,000, that stands out. The other towns that are listed there, their deaths did not go unnoticed, but we also had a wonderful partner who was ready, and the area of Norwich was ready because they have a very strong network of providers to begin with. So they were looking for a system like 211, and as we like to say here, why try to create what's already here? So in order to be eligible for this pilot, you must live in Norwich or the pilot area. This gives you the 21 zip codes and 30 towns that are included in the pilot. And other than that, the callers or potential members of the Norwich Coordinated Addiction Recovery System, we like to call them members, have a history of substance use disorder. They may have previously engaged in recovery services, or this may be their first step towards their road to recovery. They often have loss of their family connections and support. They have identified for themselves that they are ready for help now, and they often have barriers to accessing care. Currently, since August 1st, we have 40 documented members within the system, 35 of which are participating in day programs, which can include outpatient or inpatient, as well as support groups. These 35 out of the 40 were connected within 48 hours of calling or accessing 211. So that's an amazing result. 18 are attending monthly CARS recovery group. We found that the members were asking for a group that was just those that were in this system. That doesn't exclude them from going to other recovery groups or support groups, but they wanted one just of their own. So that was something they asked for, and very quickly Reliance Health was able to put that together. And as of yesterday, 8 are receiving medicated assisted treatment. So how Norwich Cars helps, which is different than other models, is the 211 Norwich Cars staff are able to spend more time to listen to the caller's recovery story. One thing that is extremely important when someone is seeking recovery or sustaining their recovery is often to tell their story of how they got to where they are today. Those stories are awesome. They will share them with you, and having staff that are dedicated at 211 to this project gives us, and I have to say for myself, the luxury of being able to listen and validate the person in recovery for the days when they were able to stay on that path and to acknowledge that some days were harder than others. The Norwich Cars also, we are collecting data from the initial call, and that we don't have the person seeking recovery have to repeat all that information. I can actually just read it back to them, things that we've already gathered, such as their name, their phone number, their contact information, allowing them more time to tell me what it is they need from our system. They will then meet in person with our Norwich Cars recovery coach, and that happens much sooner than calling a program or scheduling an appointment on their own. That's extremely important to the success of this program, because the connection with actual people face-to-face who can see their success, see their trepidation, their anger, allows them to open up in a way that makes it harder when they want to turn back to a substance that they're struggling with, because they can see our recovery coach's face saying, you know what, you can do this, and if you can't, you know who to call. The Norwich recovery coach is also able to help gain family support by reaching out to the family with the individual. 211 can certainly assist with that as well. Families who are trying to support someone in their recovery often feel that they've heard this all before, and they don't trust that this road is going to lead to any better place than the roads that their loved one has gone down before. But sometimes the person in recovery just needs to choose the right words, and so they'll bounce them off of the recovery coach or someone here at 211. And sometimes we will do a three-way call to that loved one, say to their mom, to help them to tell mom how this time is going to be more successful, and to ask for forgiveness at times for behavior that has gotten in the way or damaged that relationship in the past, and to seek continued support. We can also help through the recovery coach and also through our resources here at 211 to address barriers. Barriers to recovery can be within the person themselves, but they can also be external, things such as transportation, access to treatment, using different types of insurance, language barriers when seeking treatment, and also things that come along with struggling with addiction, such as access to basic needs, such as food, shelter, this time of year, having a warm place to lay their head while they are trying very hard to get other things back together, such as employment or their families. The Norwich Cars recovery coach also attends local support group meetings with individuals, supporting the connection to a recovery community. Recovery is a path that is unique to everyone. So all of the members work on a wellness recovery action plan that is led by the person seeking the recovery. An integral part of that is building a recovery community. It's not always easy to do that. So our recovery coach will often say to them, you've got to go and kind of try on the meetings. See which one feels like a good fit, and what feels like a good fit today might not feel like a good fit tomorrow. So always have a couple of options. And one of the beauties of the program is that she not only knows where they are, but she is in recovery herself and will go and model and be that silent partner in the room if the person wishes for her not to acknowledge that they came together, or she will be very open that she came through the door with a new member who would like to try on the meeting. So those are things that don't happen in every system that we're proud to have as part of the Norwich CARS system. CHIFA funding ends at the end of November, but due to the work that we've already been doing and the preliminary numbers that we have, we are very excited to be receiving a portion of the Department of Public Health funding that is coming to the state of Connecticut from the federal government. And that money will allow us to extend the time for this pilot in order to show longer longitudinal data. It will also allow us here at 211 to offer a text option for those who wish to access the CARS program, and that will be connected to our website. It will also allow us to evaluate the member's experience 6 months after the initial intake. This is very important so that we can see what we are doing well and what we need to improve upon, as well as to get direct input from those who are in recovery. It will also allow us to do some marketing so that more people know about the Norwich CARS program, because we don't want it to be another best kept secret in Connecticut. At this point, before I put up my contact information and ask about questions, I am going to put up our website in order to show you, if you went to our website and simply type in Norwich CARS on the main page, it will bring up the listing. The listing will give you the program description. It gives you all the eligibility requirements, which basically are where the person resides. It will also let you know all of the different services that can be accessed through it and how to access it simply by calling 211 at this point. I'm going to then minimize that and bring back up our last slide, which does give you my name and contact information, so that if you think of questions after the webinar is over and after the question period, you are welcome to send me an email and see how we can assist further. At this point, I'm going to turn the presentation back over to Kate to close it out with some important information. Thank you.
Thank you, Kim. That was such a great overview of this wonderful pilot. So we do have a few more moments before we officially close down the webinar. So if anyone has questions, we're going to take about a 30-second pause so that you can type in the questions and I can monitor those. And then what we'll do is, if there are questions, I will read them out, and then obviously we will provide some answers. So just a quick pause, type in your questions if you have them, please, and we'll be right back. So we did have one question to show the slide again for the coverage area for the pilot. So that is up, and we will give it just another minute or minute and a half to see if anybody else has other questions. We'll keep this slide up though if you need to make note of anything here.
And do keep in mind that if you are assisting someone or you yourself are calling 211, you would simply just give your zip code, which all of our call specialists would start with by, greeting you when you call us and asking you what area you are calling from. The list here is also hanging by the side of most of the computers of our specialists so that they know that you are calling from the catchment area, and you can use the town name or the zip code.
Thanks, Kim. So one more second, we'll check for more questions. So we did have one other question. Thanks to those of you who are typing them in. This is great. So the question was, have all of the enrolled participants stayed in the program so far?
And I am happy to report that the majority have. Keep in mind that staying in the program means that they are engaging either with the recovery coach or other aspects of their recovery, which can be a variety of different things, such as they are seeking treatment, they are joining support groups, they are receiving medicated assisted treatment. We are not able to, nor would it be in anyone's best interest to force people to stay in it. We have had one member at this point who started with the program, was about to go inpatient for treatment and decided that this was not the right time for the member to do that, and has asked not to be active as a member anymore. That information is still within our database, so should that person, let's just call him Bob, if Bob wants to reactivate his membership at any time, he is welcome to do so by calling 211 back or by reconnecting with the recovery coach in Norwich. We do have one other member who is, again, like Bob, still trying to decide how active they want to be at this point on their path to recovery. So that person I would consider inactive as well, but still a member should they want to return.
Great. Thank you, Kim, and thank you again for the folks who did submit some questions. I think that we're going to wrap up the webinar now. I'll put up the last slide again, so if you need Kim's contact information, that is available to you. Thank you again, Kim. This was a great presentation. And stay tuned for future webinars that United Way of Connecticut 211 will be offering. Again, that was from 211ct.org on the Professionals tab under Outreach and Training. We're very grateful for all of you that have tuned in, whether it's your first webinar or your 10th webinar tuning in with us. We really appreciate it. So we hope everyone has a great day and a great holiday, and take care. Thank you.
Thank you.